Okay, good morning, Wakefield. I think we're all on now. Welcome to a hastily put together COVID update. There are so many changes that were announced by the state the other day. And what's great is, that it does show that we're getting to the other side of this mountain, coming to the end of the tunnel. But what is a little bit nerve-wracking to us is that we don't get a lot of advanced warning. We just say there's going to be a announcement tomorrow, and then boom, everything's there. So I guess that's pretty good. But before we do go there, I want to congratulate. If you can show the map, please, Ryan. Really congratulate the state. Most of the state, I think there's 20 plus communities now in the red, and that keeps on going down, which is great. Wakefield has done really well. And so congratulations to all of you, being safe, wearing a mask, keeping your numbers down, not going into big crowds. Over the last 2 weeks, we went from a 3.52% positivity rate to a 2.39% positivity rate. And that data can be viewed on the Wakefield dashboard. And, having 76 positive cases, which is still 76 too many, over the last 14 days is really, really good. And maybe Ruth can jump in. You can take the map down now, Ryan, too. Thank you.
Sure. Thank you, Steve. Yes, the numbers are very encouraging, and they continue to go down each week, which is fabulous. I did a little research, and last week we had 26 positives, and the last time we had only 26 positives in a week was the first week in November. So it's been a long time since we've seen those numbers, which, again, as Steve said, we're not going to be really happy until it's zero, but we're definitely in the right direction, and things are going well. We do need to keep it up. As Steve, I guess it's my job to be Debbie Downer and remind everybody that, we're not out of this. We're not free and clear. And so we do need to keep masks when appropriate, social distancing whenever appropriate. But the numbers are really looking good.
Thank you. And great job, community of Wakefield and around us. I wasn't surprised to see the town of Yarmouth in the red, having been down the Cape this past weekend. Very different world down there. I was going to call Ruth and have her come and do some spot inspections for me, because wasn't a lot of social distancing going on. But be that as it may, and I'm really happy that, I was very worried, and I know Tom and I and Ruth have talked about this, a spike after the spring vacation, April vacation, but hopefully, knocking on wood, we're beyond that. So hopefully people, we're good going forward. But a lot of exciting news as we reopen, and we thought we'd put together a little PowerPoint to kind of talk about when things are happening, what's happening, and these are all subject to change by the state, all subject to guidance that when Jen and I put this little PowerPoint together, and you can pull that up, Ryan, if you don't mind. The guidance wasn't out, and I guess a lot of that guidance has come out in the last day or last night, so we will talk about it. So next slide, please. Please go to the Mass website if you have any questions. It's right there. Go to the next slide, please, Ryan. So there's a lot of dates where things are happening, and I am very pleased that at least we have these dates in advance. Because we oftentimes in the past, we would say, hey, this is going to happen tomorrow or next week. We have a little bit of time going here. So effective today, relaxation of face covering order for outdoors. What I think this means is that, and Ruth and Tom can jump in, is that if you're walking in your neighborhood, you're walking around the lake, if you're walking through Break Hard and there's nobody around you, or if you're sitting out in your lawn chair in the common, there's no one around you, you can certainly remove your face covering. Walking maybe back and forth to your car in a parking lot and no one's around you. But maybe Ruth and then Tom can jump in on this, because that's how I understand it. Ruth,
Yes.
why don't I start with you?
Yep, thank you, Steve. So, yeah, we were given some more information about an hour ago. So, so basically, Steve's going to be going through these dates, and I'll throw a few comments in as he does from the information we were given this morning. Today's part, basically, if you go onto the state's website, as of this morning, you will find a lot of the guidance has disappeared. If the guidance has disappeared, it means that the specific guidance for that business or activity is gone. And the only thing they need to do, if it's a business, would be follow the general workplace standards. For example, the library guidance is gone as of today. They don't have to quarantine books. The only limitations they have would be the same ones for indoor space, office space. That is all that they are required. So if you're, the next question somebody's going to ask me is sports, which is a big question. And that is not on the state health department's website. It's on EEA's website. So if you do mass.gov/EEA, all of the adult and youth sports guidance is on there. And I'm going to let Steve keep going because some of that has to do with future dates.
Okay, thank you. I want to go to the next one. And Tom, please jump in as well. Large venues like stadiums and arenas, 25% capacity. And I guess there might be some other DESE websites regarding high school sports, and I'm sure that'll come out. And I see Ruth raising her head. Amusement theme and water parks, we don't have any of those here, but they are 50% capacity. Road races and walks, this is something we're going to have to look at. They talk about staggered starts. So I think I did reach out to the town council, and we'll be talking about that because we have a lot of people that are looking to have road races and walks, and we're really going to have to consider that coming forward to make sure people are safe. Sports tournaments, they're also going to be allowed again, I guess. And indoor singing with strict distancing requirements, one I'm very happy of because I would like to go back to singing in some of the local places, and I'm sure their business will increase when I'm there. So the important thing to note is that any of these events that come in, there will be approval from the local boards of health. And as of yesterday, we were still waiting for CDC state guidelines. Maybe there's more of them. So Ruth and then Tom.
So the items that are listed on this slide that take effect on May 10th, which is my birthday, by the way.
That's why they chose it.
The guidance for that, we were told this morning, will be out next week. So I can't give answers for specific questions until the specific guidance comes out. And at our 9 o'clock meeting this morning, we're told that will be next week. So as soon as it comes out, we'll put links on our website. The public always can be watching, especially if you have a particular interest, to be watching either the DPH website or DESE's, DESE. The Department of Labor of Standards also regulates all the business parts. So if you have a question about your business, and then if you have questions about outdoor recreation, that's EEA. And maybe we can come up with a little cheat sheet to put on our website that kind of says what all the acronyms mean and which guidance to look for on specific sites.
Perfect. Thank you. Tom, did you want to add anything to that? Tom, our Emergency Management Director.
Yeah, what's happened is, nothing has been put in writing, as Ruth said, even on the federal level, when you saw some of the changes when the president was making his address the other night. So people have this anticipation. The thing is, we'll just have to wait until the actual, the written rules and changes are made, and then we'll put it on our website and we'll take care of it. But I think people feel that there's a freedom, but until we get the actual written notification, we won't be able to then implement it.
Great, thank you. And just so a lot of people that have applied for road races and more walks around here, we have reached out to them via our, they have applications in. We've reached out and told them that guidance is coming. So hopefully keeping them a little bit at bay so we didn't get inundated with phone calls with guidance we don't have. Doug, I'm gonna pull you in here. Anything, how does this affect our high school graduation and prom and things like that?
Yeah, there's different guidance for graduation. And so and for outdoor venues, we can have graduation. We'll be able to accommodate the entire class up at Landrigan, which is a really wonderful change for us this year. We've also been given guidance on number of guests, which is really good and really positive. And so, but all of this information and guidance is given with safety and mitigation disclaimers or procedures that need to be followed. You can put, people in the stands, you can put people up on the turf, but we're going to need to maintain social distancing. We're going to need to make sure that people are symptom free. We're going to need to make sure just a number of things that we'll have to put in place. The good news, the very, very positive news, is we're going to be able to have a full graduation with the entire class on the turf, which is really wonderful. In terms of prom, the initial guidance around prom that came out really had some very strong limitations. We're anticipating that is going to change as the governor's guidance changes and they're reopening the economy. So more information to follow on prom. We also got some information on quarantining when students are in class and on the bus. They no longer need to quarantine if they come in contact with a COVID positive person, unless they are within 3 feet, which is very positive as well. So we feel like those small little adjustments are all opportunities for us to get back to school as we know it. So that's a very quick update, Steve.
Great, thank you so much, Doug, for that. Great for our students and families on that. Let's go to the next slide, please, unless anybody else has something to add there. Nope. Okay, gathering limits, 250 outside, 200 inside. Festivals and parades, 50% capacity. And I will tell you that I do not know what 50% capacity means at this point. I'll wait for Ruth and Tom to jump in as we go through that. Bars, beer gardens, breweries, wineries, and distilleries to follow restaurant rules. And this is all effective at the end of May. Seated service only, 90-minute limit, like there is now. Restaurants increase table maximum to 10 people. Elimination of requirement that food be served with alcohol. And I will tell you that in Yarmouth and Hyannis, it's already May 29th, as far as I can see. Ruth, anything to add there?
Yes. So, yeah, I think this primarily will more affect our social clubs. The restaurant guidance, the basic restaurant guidance will stay in effect, except the table size to 10. But again, they're going to come out with more specific guidance before that. I've fielded multiple calls already since Tuesday from businesses and organizations about what they can do. And I wish I had the answers for them, but until they, as we've said, come out with the written guidance, what the governor announced was very broad stroked, and the details are being filled in. But yeah, the guy, moving from 200 to 250 for gatherings certainly makes a big difference for a lot. And the sports guidance also, I think, will make a big difference for people.
I have a feeling people are going to send out a second round of wedding invitations You made the 200 cut list. You didn't make the 100, but you made the 200. So that'll be interesting coming up. Tom, did you want to add anything?
No, again, it's, we have to wait to see what the actual, how they're going to address this stuff. I don't know how you do a 50% capacity on festivals and parades.
Yeah.
So maybe they'll delineate it a little better. But I think that people just have to wait and see. I don't think we'll be doing anything of that nature. Plus the fact that when you put all these people together, how do you still keep them safe? So I think we're going to have a little bit more notification from the state on how we're going to address these issues.
Great. Anybody else want to jump in here?
I wouldn't be surprised about some changes to the 50% parade stuff. They've been told in multiple forums that doesn't make any sense. So I anticipate will change.
Yeah, I don't know whether that means 50% of the capacity of the parade givers or the parade bands and things, or the people going there. And how do you say 50% capacity when you have an open parade and you have open streets? And
right,
it's an interesting dynamic, I think.
It does mean 50% of the people watching the parade.
Yeah,
which all told them is ridiculous. So.
Ridiculous, yeah. Okay, if nobody else wants to jump in, let's go to effective August 1st. Well, as of now, it looks like everything will be open on August 1st and all limits to be rescinded. I heard the governor, I think yesterday, say that maybe this would be actually a little bit sooner, depending on vaccination rates. But again, Ruth, Tom, anything to add here?
No, it's all, as always in Massachusetts, it's always data driven, is fabulous. And the governor did say yesterday, if the data shows, further and further declines that allows us to open earlier, that really is dependent on us. And if you have friends and relatives that are vaccine hesitant, we're lucky in Massachusetts that we do not have a large proportion of people, but we do have a proportion of people who are vaccine hesitant. And anything you can do to help allay their fears, or have them call us, or have them talk to their own healthcare provider. It's really dependent on as many people as possible being vaccinated, because remember, the vaccine is still only approved for either 16 or 18-year-olds. So no matter what, we still will have a large population that will be unvaccinated for now.
Right, and this is probably a good segue before we go around the table to where is Wakefield in the vaccination report? And as of April 29th, which is yesterday, total of Wakefield, 40% have been fully vaccinated, 40% of our population. And of that, when you break it down by age groups, 75 and older, 77%, 65 to 74, 77%. So there are still, almost a third or a quarter of these people that have not been able to obtain or don't want to obtain vaccinations. And so that's a little bit concerning. I would have liked that number to be higher. 50 to 64-year-olds, 53% are vaccinated, which is good, given that I guess they just came in. 30 to 49, 42%, and 20 to 29, 27%, and 0 to 19, 2% are fully vaccinated. And if you look at the state numbers, that 20 to 49-year-old is really where the spikes are occurring. So I would hope, and I encourage, and think you'll hear a lot more about this from our community. Please, the best thing you can do is to get out and get vaccinated. And I thought that was very telling what the governor said yesterday on his news conference. Said, hey, you want to open up the state earlier? You have the power. Go and get vaccinated. So, I think a lot of us that have been vaccinated, we're still here. There's no issues for us. So I'm encouraging everybody to get vaccinated, and let's all get together. It not only helps you, helps the people you come in contact with. So if we can pull that down, Ryan, and maybe go around the table, I'd like to thank you. First, turn it over to our chair of the town council, Ann Santos, who always has some words of wisdom for us.
Just very quickly. And my first word of wisdom would be ball pits should not exist anymore. I can't believe that they even articulated ball pits.
They should have existed before.
Oh my God, they shouldn't have existed before. And I want to see the first parent who throws their kid into a ball pit. But I want to just thank this whole team, frankly. As I segue out of being chair of town council, I can't imagine a team that has been better in the state nationally than what we've done in Wakefield, and to be transparent with information and work together and really support each other. So our Board of Health department is beyond any that I've ever seen or experienced. Our school department has been working hard, DPW, just everyone. So I just want to thank folks, Jen McDonald, with the information she posts. Wakefield, where we'll have some information, I'm so sure, about what Steve talked about with regard to walking around the lake or lake events, and probably some cautions there, but just I wanted to thank everybody. So great job, keep it up. Let's get those young people vaccinated, which I think is happening a little slower, but I do think, we've seen that even with my own son, his doctor's office called and said, do you want to come in and get vaccinated, which is wonderful. So thank you all, and just great job.
Thank you. And Julie Smith-Galvin, our vice chair, and congratulations to you on your wonderful reelection. So
very much. I don't have anything to add except my thanks. It's so great to see these coming out, and Doug, that you're already thinking how it's going to, possibly change what we can do for the seniors. And as a senior parent, I have great interest in that. So just keep up the good work, and everybody, please, tell your neighbor, ask whether you've been vaccinated. And I've been really encouraged by how people have been reaching out and helping people get appointments. So that's great. Thank you so much.
thank you, Julie. We are joined by Councilor Maureen Butt. Maureen, did you want to unmute and say some things? I don't know where you are. You're in front of some place.
The pictures from Morocco. I'm doing three conference calls at the same time right now. So I can't put the screen on, but just want to echo what was said. Great work, Steve, Ruth, and Tom, and everyone else. And yes, just to pitch out there that we can see the end of the rainbow. So just keep on getting vaccination. I have helped numerous people. Reach out if you need help, but let's get vaccinated so we can start meeting in public and giving hugs again. So thank you.
Thank you, Maureen. Elaine Silver is on our from our Board of Health, and Elaine is wonderful. I call her Nana Silva, like everybody else does. She needs to unmute though. I've never known her to be shy. There you go.
Being shy, never. Just a thing that, being in public health for 20 something years, I think that the town of Wakefield and Mr. Mayo and Ruth and to Tom should be very, very proud of themselves of what they did. The model that we had here was admired by many people, and I bragged about it a lot. And a lot goes to our school department. I'm so happy that things are going back for them to be right. I have a granddaughter that's a senior, and I'm so excited that I might be able to see her graduate, the first one. I'm really excited about that. But just the fact that people have to understand that, as Ruth said, everything changes. At 9 o'clock, it's one way, and at 5 o'clock, it's another way. So they're just going to have to keep up. And Jennifer, thank you so much for everything you post. It's been wonderful. I refer to everything. And just to give us time to adjust to everything and to go through it and make sure that what we have on the websites is right. And just be patient with us, because it's going to take a while to really get everybody back to normal.
And people who didn't get a chance to see Elaine at our clinics, oh my God, Elaine is like this sea of calm there, making sure all the vaccines are right, there's no issues, everything's great. So thank you for all the time.
Thank you. It was my pleasure to do it. I love it. That's my thing.
Thank you so much. Doug, anything to add? And Doug, school department's done a great job. We've had our kids in school, at least hybrid wise, since the beginning. So kudos to you in keeping that going.
Thank you so much. I got to include the teachers in the thank yous and our nurses and our admin, right? And so it's been a team effort. So we appreciate all the efforts every day. And like I said, as we're getting everyone back, I think the teachers are really thrilled to be seeing students in person and being able to teach in one platform. So I think that they're really looking forward to that. As the numbers are going down across the state, we're seeing our numbers in schools are kind of fairly consistent at between 8 and 12 cases a week. This week we have 11 student cases. The majority of the cases are at the high school level. We also have 53 students and 1 adult in quarantine. Several of the people in quarantine is a result of travel, which is really positive, which lets us know that they're following the travel advisory from the governor, and it's great to see people following the rules, and it's very supportive of us and the community. So we appreciate that. But that's it for me at this point.
Thank you, Doug. Let's see, Tom.
The only thing I had to report, something good is, when I've been watching it, is the amount of fatalities we've had from the disease has been hovering around 9 a week when we were doing 300 and 400 a week. I mean, this is great. I mean, we want to get it down to 0, but that's kudos to that. Our cases are still high. I mean, our low point was last July 4th. So but the numbers are going down. So I feel confident that we're going, in probably a month or 2, we'll be in real good shape.
Great. Thank you, Tom. Ruth, any parting comments?
Yeah, I just have one thing to say that we've completed our homebound vaccinations. So actually right on schedule. So everybody who had contacted us needing a vaccination with homebound, we did some with J&J during the pause. We switched to Moderna. Those people need second doses. And then this week we went back to J&J. They don't need second doses. So as of tomorrow, the state will be doing any homebound vaccinations for residents of Wakefield. If you call us, we're going to refer you to the state homebound group. We don't have the volume of requests now, as everybody now knows with multi-dose vials. You need a lot of people or a certain number of people to do it. So as of today, essentially, if you know of somebody who's homebound, they will call the state program and be put on their list.
Thank you. Great information. Anybody else want anything to add? And some of our loyal listeners, anybody want to add anything? Unmute and go ahead. Okay. All right. Seeing none, Wakefield, stay safe. Please encourage your friends, relatives, family to get vaccinated if they haven't been. That is the best way to get us out of this, and remain safe. Everybody have a great weekend. Sun is supposedly going to come out, so we'll all get those walks in, right? Thank you, guys. Have a great day.